I was just thinking what else I learned and I'm taking away from this conference. I think there are a lot of people in developed countries who are very advanced in talking about measurements. That is why I'm hoping to join the measurements group. I'm a doer rather than a sort of reporter. And I'm very bad, and I do things intuitively without thinking, planning how it's done. And I'm very bad at describing what we actually do and what actually works and what doesn't work. And I think it's important for us to reflect on that, to see what lessons can be generalized and what lessons are very specific and contextual. And the other thing is, I was fascinating with the culture cafe. Because although I've worked in many different countries and listened to many different situations, I learned ever such a lot in that culture cafe. I went to 3 groups. I went to the Philippines, where I've been working since 1995. I went to the group in Korea, and I have a lot of Korean colleagues, and the one in India, where we currently have a project. And in each place, I learned so much about the culture that impacts on palliative care practice. I think palliative care is very culture specific. When we go into these countries to say, we want to help build capacity for palliative care, it's not that we bring a formula and say this is what palliative care is. It's really our going in to say, well, let's discover together what palliative care should be in your country. And this is what makes the work really fascinating, because palliative care in each country is going to be different. So we're not there to tell them how to do it, but to say, well, let's find out how it should be done or what works in your country.